Hey, I'm Dr. Joe Niamtu, LoveThatFace.com. I'm a cosmetic facial surgeon in Richmond, Virginia. I do surgery from here to here. I don't do boobs, bellies, or butts. I'm a teacher, I'm an author, and I'm a surgeon. Today we're going to talk about one of my favorite procedures, and that is cosmetic blepharoplasty or eyelid surgery. And I've done over 6,500 eyelids, and again, it's just one of the favorite things that I do. It's a pretty straightforward surgery, and the recovery is pretty small, and patients are very happy. So we have a great patient today, and we're just kind of talking, and she has, we'll zoom in and show you some pictures later, but she has a lot of extra skin on her upper lid. It's touching her lashes, and she has eyelid bags, which we get, and we're going to address these by doing upper and lower eyelid surgery, and we're going to kind of follow her journey. So tell us, what's brought you here? Why do you want to do something with your lids?
They are hereditary. I have had them my entire life, and since I've been a teenager, just been very, very self-aware of them, and I feel like they make me look tired, and it doesn't matter how much sleep I get.
Right, and that's what we hear a lot. And people say, they take care of themselves, they eat well, they work out, but you can't do anything about these. And sometimes it's a gift from our parents, if you know what I mean here, like with my hairline. So this surgery takes about an hour. The recovery is about a week. And what do you want to get out of this surgery?
I'm hoping I will just look a little bit younger, a little bit fresher, more awake than, and that's more how I feel. So just to have that align better.
And that's perfect. And that's kind of why I asked her if she would consider doing an interview. Doing cosmetic surgery for the right reasons is important. And what she said with eyelids, it just makes us look older and tired. And people come in and they say, my coworkers are asking me if I'm tired, if I can get sleep last night. So it definitely opens up your eyes. It makes you look more aware, more alert, and that makes you look younger as well. So I'm excited to be your surgeon, and we'll follow you through this journey. Okay?
Sounds great. Thank you.
We'll be back. So we're going to take a close-up look here. And on the upper lid, what happens is we get this extra skin. And if I pull that down and let go of it, you can see how it just hangs. So our goal is to reduce that skin and a little bit of fat and make the eyelid look more like that. We're not going to touch her brow because she has high brows, so she doesn't need a brow lift. On the lower, we have these bags, and this is protruding fat, and there's 3 fat pads down there. We're going to actually make a little small incision inside the eyelid with a laser, and we're going to remove reduce those 3 fat pads, laser that skin, and make it more like that. So we use lasers for this, and by doing that, there is virtually no bleeding, and that's a quicker recovery, less discomfort, and less bruising. So we'll see you on the day of surgery. All right, it's game day, and we're going to do upper lids, lower lids, and lower lid laser. So right now, we have marked where the fat pads are. Look up over your head once, and this accentuates that. So there's a nasal, a medial, and a lateral. Same thing here, 1, 2, 3 fat pads in the lower. Okay, just close your eyes now a little bit. And we've marked this, and this is anything between these 2 blue lines we're going to take off. And this is really a game of very precise millimeters, so we're going to take off that much skin. And obviously, the patient needs to be able to close their eyes. So now, you can back up a little bit. And you ready for today?
I'm ready.
All right. This surgery is going to take about an hour, okay? And when you wake up, you'll do fine. You're going to have some laser on the lower lid and some stitches up here. And the sutures, there'll be no sutures on the bottom because we're going to go from the inside. Let's rock and roll.
Sounds good.
Thank you. So we're going to be using the luminous CO2 laser to make our incisions, which will be bloodless. And I love doing blepharoplasty, and I'm very excited to be doing this case. So here we are, about an hour after surgery. The surgery took about 45 minutes. And upper lids, lower lid, we did the transconjunctival approach. And of course, the redness is from the laser resurfacing. So how are we feeling?
Not bad.
Okay. Does it hurt?
Stings a little bit.
Okay.
Yep.
Yeah. Well, it's going to do that. So, all righty. Well,
I'm excited. I
I'm
think it's going to look
excited too.
good.
It looks better already, but you can't tell, and you have to be a caterpillar before you're a butterfly. Okay. So we'll follow you through this and see you in a week.
Sounds good. Thank you.
All right. Time flies when you're having fun. So here we are at our 1 week post-op visit, and let's take a look at our great patient over here. So we did upper lids, lower lids, and lower CO2 laser. Close your eyes for me. So she's still pretty swollen here. This will go down significantly here over the next couple days, and these are dissolving stitches, open. But if you remember her preoperative picture, she had a lot of skin hanging down, and over the next week or so, this will go back like that. She had some significant fat bags here, and those are just gone. We still have a little crusting from the laser, but that skin looks smooth as a baby's butt. And we have a little bit of bruising. Not everybody bruises, but some people do a little bit. So how was it?
Not bad.
Okay.
Not bad at all, actually.
All right. What was, did you have much discomfort?
No, not at all. The first, right out of surgery was a little uncomfortable, but it went away pretty quickly, and slept with my head up and managed pretty well.
Great, great. Well, you followed all our instructions.
I did.
Was there any one part that was harder than the other, or was it?
No, I did everything like you instructed to do. I washed my face very gently and kept everything very, very clean. And I think everything went really well.
Well, it's really great to have, number one, to have great patients. Number two, to have patients that follow instructions. And she looks really good for being a week out, and what she had. This is still really swollen, but that's going to go down, and we'll see her back in about a month and follow this case. I'm Dr. Joe Niamtu, LoveThatFace.com. After several months, the person on the left looks like her older sister. It's a great case. She's happy. I'm happy, and it's really amazing. When you look up at the ceiling, it accentuates the eye bags. It's just a great feeling to make people look this good. And there are different cameras here, so there's a little bit of shadow on the left, but you can tell it's still just a really great case, and I'm so honored to have helped this patient. If you have an interest in cosmetic blepharoplasty, eyelid surgery, deep plane face and neck lift, any other procedures on the head and neck, look me up at LoveThatFace.com. I'm Dr. Joe Niamtu. Have a great day.